day today. I wish the rest of the country could enjoy and share our beautiful weather, but they cannot. Traffic looks pretty much the same right now if you're in the Dallas-Fort Worth area. Just a visual for you on 183 coming into Dallas. If you're in the Mockingbird area, you could be in a little bit of trouble. It's moving slowly, but it is moving. If you're going out of Dallas on 183, things are looking fantastic. And I-35 going from Mockingbird out of Dallas and into Dallas is moving swiftly. Super excited. It is the great honor to always have Lisa Myers on with us. I love talking to Lisa, love listening to Lisa speak. Lisa, good morning and welcome to JP, Kathy, and the crew.
Good morning. I love being a part of your very special program. Thanks for having me.
Thank you.
You betcha.
Welcome.
And then we've got Christine Peat joining us from University of North Carolina, Chapel Hill. Is that right?
That's correct.
How exciting is that? How is good old North Carolina today?
It's going to be a beautiful day. Can't complain.
Hey, there you,
Awesome.
there you go.
Love
Welcome
it.
to JP, Kathy, and the crew. We have got with us always just as excited as I can be. We have the Morgan Foundation and the Something for Kelly Foundation. They are joining us here in studio for the Mental Health Moment. They are the founders of the Mental Health Moment. Brought it to us and said, would you be willing to do this? We said, sure. So we created a collaborative effort with both of them. And so Patty and Steve, good morning.
Good morning, John and Kathy. Thank you so much for allowing us some extra time today.
You bet. This is the extended remix special. I was trying to make it sound fancy earlier, and I was like, oh, we've got Patty and Steven. It'll be great.
Good morning, guys. And on behalf of both the SFK and the Morgan Foundation, thank you both for having the same vision that we have, just to bring mental health out of the darkness into the light to help as many folks as we can.
Well, and, I'm excited also, Lisa and Christine, because Steve told me that I get to go off today a little bit on our topic. And so I'm a little excited about that as well. And so to get me out of the seat, because I could just talk for hours, I'm going to turn this over to Steve and Patty, and let's get this thing fired up.
I've already told the crew that you were going to be going on a bit of a rant. No, yeah. But you're giving your own, but seriously, you're opening up your life and giving your own take on eating disorders and things of that nature. I think that's really important because, again, you're putting your money where your mouth is. Not enough people talk about mental health, and in particular, eating disorders. It's still in the closet.
Absolutely.
Kathy, it is. I'm sorry, Steve. Kathy, it is. I want to just say something real quickly. The reason that we have some extra time by virtue of Kathy and John's very gracious nod is that this is Eating Disorder Awareness Week. And that's why we are also having these two very special guests come in, because they are very high-ranking in the eating disorder world, and they have a lot to share. So, Steve, I know you have some things you want to start off with right now.
Absolutely. And as everyone knows, this is simply a rich little white girl's disease. I can't count the number of times when I've heard people in essence use those words to describe what eating disorders are. But nothing could be further from the truth. I wonder if one of you could jump in at this point and talk about how everyone is impacted by this disease.
Sure, I'm happy to jump in there and talk briefly about some of the stereotypes that exist about eating disorders. I think that for a long time, our field and the larger medical field was really encumbered by the fact that we had this one particular view of what an eating disorder looked like. And typically that was someone who was young, female, thin, and typically fairly well off in terms of socioeconomic status. What we've learned over the years in terms of the research is that eating disorders do not discriminate. They can occur in anyone, regardless of age, gender or sexual identity, race, economic background. And the more that we can do to broaden that lens of what an eating disorder looks like, the better chance we have of identifying and providing treatment to people that really need it.
Where do you think the blinders originally come from? Did they come from within the population or from within the medical community?
Oh, that's a great question. I think that there's probably some of both. It's probably 6 of one and half a dozen of the other. I think that for a long time, those are the individuals that we had identified because that's what existed in the medical text. And so it was sort of run with, both in the medical field and also among the general population. But I think that as individuals with lived experience have come forward and talked about their lives with an eating disorder, the medical field has started to slowly turn and say, listen, we need to do a better job at paying attention to these individuals as well.
Lisa, now
another issue.
Go.
Another issue is that you can't tell that somebody has an eating disorder necessarily by looking at them. And if you are extremely, extremely thin, you can look at somebody that's extremely thin anorexic, and you can say, okay, something is not right here. But you can also see somebody who appears to be in a normal weight body that may be struggling with a serious eating disorder, and you can't see it. So that's one of the challenges that both the field and physicians and health providers have had.
Lisa, that's a really important point. And to underscore that, Steve and I were in a meeting yesterday with a group of folks, and we were bringing up the subject of mental health and eating disorders. And one of the principals at the meeting looked to be a very healthy, average weight young man. And he came right out and said, this is important because I just binged this morning and I have a problem with an eating disorder. And I don't talk about it because I'm embarrassed about it. There's a stigma around it. And I promise you that he did not look at all as if he had an eating disorder. So really, to underscore your point, Lisa, it is so true. You cannot look at somebody and know that they're cured. You cannot look at somebody and know that they're ill.
You know, and
Exactly.
when we're looking at this disease, though, and how to treat it, we know if you are employed and you have health insurance, you can obtain the best help that is out there. But there are millions of people who suffer from this disease who don't have insurance in place. What is there? What exists out there for them to get some type of help?
You know, unfortunately, treatment options for individuals who are either uninsured or underinsured are pretty limited. And this is a real problem in our field in terms of access to care. We do know that there are some programs, usually those associated with universities and medical centers, that can take Medicaid, Medicare, TRICARE, and also the uninsured, but those only represent a small number of inpatient beds and a small number of outpatient services. So, you know, we're really challenged as a field to try and find the right fit for folks that may have to travel great distances, that may not have a lot of cash on hand. I think you really hit the nail on the head in terms of identifying a real problem within our field.
So we know there are websites like MedicareInteractive.org where people can go on there, and you know that site in particular has some great information and an extensive, frequently asked questions site. Have either of you dealt with or helped someone walk through basically how to get Medicare assistance?
AED has just published a publication that's available at no cost for download from our website. That is a guide to, it's really aimed at healthcare professionals to help them help patients get coverage. But if you were a patient or a family member caring for somebody with an eating disorder, it would still be useful. And it suggests the ways to frame your arguments with the insurance companies, who to contact, how to explain to them what it is that you need. And Steve, I want to correct something, if I may, that you said. You said that if you are employed and you've got a great employer and a great insurance program, you are not going to have a problem. But in fact, some forms of eating disorder, many forms are what are called severe and enduring. And even the best of insurance policies have limits to how long, how much treatment they'll fund. And it often still is inadequate for the job to be done.
And we know in great part that's because insurance companies treat an eating disorder as if it's an acute disease, that if you hit a certain weight, if your BMI reaches a certain part, then they want to immediately step it down. What can we do to try to educate or get insurance companies on board with the proposition that this is a chronic disease? It doesn't just go away when you hit a certain weight or a certain BMI or when you start to eat. You know, what can be done to get that word out more?
I think
One of the
organizations
things that
like
go ahead, Christine.
I was going to say that I think one of the important things that's happening is that there are organizations in the field like the National Center of Excellence for Eating Disorders, the Academy for Eating Disorders, the Eating Disorders Coalition, that are really working together to try and put forth legislative efforts to improve access to care. Of course, as with any legislative efforts, these are slow-moving processes, but I think the more that we can do to come together as a field with a united voice to say that these are at times very chronic, very serious illnesses that require more than just a benchmark for weight, the more that we can have an impact in those areas.
Now, the other thing I was going to mention, sorry, I'm talking too much, but the other thing I was going to mention is that I know from my work in other fields, and I believe it's equally or more so true in the eating disorder world, governments and companies, organizations respond to economic arguments. They need to know, why does it matter to them that they provide more treatment for eating disorders or help us solve some of these problems. So AED has recently commissioned, I'm so excited about it, it's one of the most important things I think we've done, a massive study with the Deloitte Health Economics Division to try to assess what is the economic impact of an eating disorder. What does it cost employers? What does it cost families? What does it cost health care companies? And to what extent does early detection or early treatment, appropriate treatment in the right setting, to what extent does that reduce the overall burden of cost of the diseases? And I think if we can come up with those arguments, for example, for every dollar that we spend on early diagnosis and treatment of eating disorders, we'll save $5 in long-term healthcare costs down the road in treating heart disease, dental problems, and the many, many other manifestations of an eating disorder.
Lisa, real quickly, when that study comes out, last week we had some guests talk about the fact that the Black community often looks at medical care as well as behavioral care from an acute perspective, where they don't really do anything about it until they need to go to the emergency room. This is going to tie in directly with your point. So are you going to have an outreach for that community in particular and how they can address that situation?
Yes, ma'am. We're trying in everything that we do to, and we're trying to encourage other researchers in all of the research that they do to be sure that they are looking at representative sample populations as opposed to studying narrow groups. I recall at one point when I was just getting into this field, finding an article that said that Blacks don't have eating disorders based on a research study. And the research study, the sample size, the sample selection of patients that were studied were predominantly not Black. So they just were underrepresented in these statistics. I'm not saying that well, but all research, including this study, but all research that's being done needs to be increasingly sensitive to ensuring that there are lots of populations represented.
You know, one point you brought up was that this disease impacts all shapes, races, and as we go on here, we really want to address the very important topic of weight stigma and mental health stigma. That's been raised by a few of our past guests, and it's something that impacts the industry so much. I know that JP, you're going to have a lot to say about this, and so can't wait, JP, to get your thoughts because it has impacted you in your life.
Oh, absolutely, and we'll get into that when we come back from the break. Ladies, don't forget that during the break we are on Facebook Live and we continue the conversation. So Christine and Lisa, if I can keep you both queued and ready to go, that would be fantastic. All right, we've got traffic and weather coming your way when we come back.
The camera a little bit this
All
way.
right. So Christine and Lisa, welcome back. We do, like I said, we have our Facebook audience, and then this is archived on Facebook, and people will listen throughout the day as we go forward. So we're going to continue the conversation. So, Steve, I don't know if you have.
Patty, and see if I think you should be able to shot.
I don't know if you want to go ahead before we go into weight stigma and all of that. We'll do that when we come back on the air.
Okay. Wonder if Christine, can you talk a little bit more now about what exactly NCEED is and what you are doing and what you foresee for the next year or two? What direction NCEED plans to go?
Sure. So NCEED is the National Center of Excellence for Eating Disorders, and we are the nation's first and only center of excellence dedicated specifically to eating disorders. We were designated as such by the Substance Abuse and Mental Health Services Administration, and essentially what we've been tasked with doing is providing education and training on the management of eating disorders to healthcare providers, to the general public. So really what we're trying to do is fill the gap of information on how to manage these conditions to groups of healthcare providers that may have had very limited exposure to this kind of training, whether it was in medical school, maybe social work, nursing. And so really what NCEED is trying to do is to pivot towards frontline providers. So we recognize that the majority of people with eating disorders are actually going to be diagnosed in primary care. But it's those physicians, it's those providers that actually have the most limited education and training on these conditions to begin with. So our organization is uniquely poised to provide that type of education and training for free for as long as we are federally funded.
And Lise, what are some great things that AED is doing in the next year or so to get the word out to expand your mission?
Well, there are so many different directions that we're moving in, but one of the, to build on the very important comments that Christine just made, one of the things that we're doing is reaching out through the National Association of Chronic Disease Management, the National Association of School Counselors, the National School Health Associations, and American Dental Association, and many, many more associations of these primary physicians and healthcare providers to just talk to them and say, hello, we're here. There's lots of information. You must know this. And to document for them, make them understand what a life-threatening disease this is.
Well, I know we are so appreciative of you guys for taking the time this week to appear. I should have this up by this afternoon, and we're going to mass distribute this show as much as we can because we're getting some great information, and I imagine the next half hour we're going to continue to get additional things. So thank you again so much.
And ladies, I think when we come back from break, I want to make sure that you have the chance to put your information out to the driving public so they know how to get in touch with your website.
Yes, because what you just gave was just our Facebook audience. So yeah, definitely, Patty.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. Join Kathy and I when we tune in this afternoon from 2 to 5 p.m. to the John David Wells Report. That's right. He gives it every day from 2 to 5 p.m. News, analysis, commentary, and debate. It is currently 8:24 here in the Dallas-Fort Worth area.
Well, and JP, we're headed towards a high of 61 today, mostly sunny and still sunny right now. A little bit of clouds out there. Colder tonight, 39, and currently here in Dallas, we have sunny and 46 degrees.
Did you say that you're getting high tonight?
No.
Oh, just checking.
Good night. No.
Oh, you're going to bed already? Good night.
No.
Oh, not that
goodness.
either?
No.
Oh.
Shut it down.
No, we can't. We're live radio. We don't
well,
want to
actually,
shut
we
it
don't
down.
want to shut down
Right.
our fabulous
no,
guests.
No, don't do
we
that.
love our guests.
Oh, Kathy, jeez. All right, real quick on your traffic. There is an accident reporting in the Addison area. Accident blocking 2 left lanes at the Dallas North Tollway and Frankford Road still. You're looking at a 30-minute traffic delay there, and traffic does look ugly. So do we avoid that at all costs if you can. Nothing else in the downtown Dallas area. Coming in from I-30 going into Dallas over the Over Lake Ray Hubbard, you are looking good there as well. 75 is clear. Gets ugly when you get down to Walton Walker, all the way down to downtown. Outside of that, your traffic is moving swiftly. This is your traffic report brought to you by SigAlert.com and JP, Kathy, and the crew. And, you know, Steve, before we went to break, we talked about weight stigma, right?
Yes.
So do me a favor. Somebody define weight stigma. I don't care if it's you. I don't care if it's Lisa. I don't care if it's Christine. Somebody define weight stigma for me.
Let's let Christine take a crack at that.
Sure. So I think that there are probably a number of different definitions, but broadly, when we talk about weight stigma, we talk about discrimination or stereotyping that occurs based on somebody's weight. So the idea typically is that weight stigma is a negative phenomenon whereby individuals are perceived or judged negatively based on their size, whether they're living in larger bodies or they have a certain appearance. And so an example of something like a weight stigma might be, for example, you being treated poorly in a store if you live in a larger body, or you receiving less quality medical care if you live in a larger body.
So perfect. And that's what I wanted you to walk me into. So I'm running for re-election. I'm at Aldridge Elementary School. This is 1998, I want to say. And Channel 4 News has come out because the phenom John Payton, who was 18 years old when he ran for office and got elected, normal guy, still normal, just, hey, the lights all lighted up, and that was God's intention that day. But they show up, and this man gets out of the car, older gentleman, short, overweight, and I'm considerably overweight. Just come from a line of women and I got all their genetics, thankfully, because I'm beautiful. And so, but I also gained their weight.
Okay, it's getting thick in here.
Hey, I'm sorry that you can't compare. I'm sorry, I make you look good. Anyways, point being is that he gets out, and the Channel 4 reporter walks over to him, and he says, are you going to be voting in this election? And he says, yes. And she said, that's Judge John Payton over there. He's running for re-election. He was 18 when he got elected. Are you a Republican? And he said, yes. And she said, are you going to go in and vote for Judge Payton? He's done all these great things with kids, and he started all these youth programs. And he looks at her and he goes, well, absolutely not. I'm not going to vote for him. And she goes, really? Have you had an experience with him? Well, no, he's fat. Look at him. He must be lazy. He's not doing the job well. I'm not going to vote for somebody who's fat and lazy. And he walks in, and she looks at me, and she looks at the camera guy and says, we're not running that. And she comes over and apologizes. And I said, why are you apologizing? I said, if I don't know that I'm fat and I'm overweight, then there's something wrong with me. And I understand that he may have a problem with that, but I take responsibility for my own weight. If I want to lose it, I need to get out, and I need to exercise. I need to eat better and have better habits. And I said, but, you know, she says, well, it's not fair for him to do that. I said, well, I open myself up when I walk out into the general public, and I understand that. And so, and it's funny, I've had several stories like that, even with little kids. Little kids will look at their moms and they'll go, look, mommy, he's really fat, or he looks like Santa Claus. And the parents are like, oh, I'm so embarrassed. I'm so sorry. And I'm like, they're little kids. We're fine. Again, I take onus and responsibility for my own weight because I know that I can control this, and I get busy, and I don't have the discipline that I need to be able to move forward and take care of that. And I did at one point, and I dropped 240 pounds doing it the healthy way, doctor monitored, no crazy diets, just eating healthy and getting out there and exercising. But weight stigma is a real thing. And if you don't have that confidence, and, you know, we'll get your reflection when we come back from the break, but if you don't have that confidence, then you may be in a situation where you could revert to a mental health type issue. But I have that confidence. I know I'm beautiful. I am who I am. Accept me for who I am or move on. That's your problem, not mine. And it always kills my bailiff because my blood work comes back fantastic and he can't handle it. He's like, how are you not diabetic? Well, because I'm not. How are you sure? Because I don't. And he's skinny and he does. So it just blows me away. So we'll get your guys' response to that. We'll go with Lisa first and then with Christine when we come back from the break, 11:60 a.m. All right. Are you guys still there?
Sure am.
Good morning.
So would love to get your reaction, and then we'll continue that reaction into the radio segment.
Well, I'm so glad you're talking about weight bias because it's a huge issue, as we all know. It often is used in the context that you mentioned it, to bully or ostracize young people. But it also can be used as a defense for not hiring or promoting somebody in the job site. It can be used like any form of prejudice to put an individual at a significant disadvantage. The EEOC, Equal Employment Opportunity Commission, a couple of years ago was considering a regulation that would allow employers to charge employees in a higher weight body a higher premium for their health insurance than all of the other employees.
Oh, wow.
And it was an absurd idea based on this objective measure of the body mass index, or BMI. And in fact, there is, as you have so smartly said, there is no direct correlation between your BMI and your capabilities. And one other thought on that: so much of society accepts that being obese is somehow your fault, quote, quote, your fault. So we don't make simple accommodations that make life more difficult for those in higher weight bodies, like theater chairs that are too small for a larger body, or airplane seat belts, or clothing options, going into the clothing store, and so much more. And the widespread prejudice has a huge impact on the mental health, self-confidence, and well-being of an individual who suffers from the discrimination. It's a really, really pernicious thing.
And if I could just dovetail briefly on what Lisa has already indicated, I think that kind of bringing this conversation full circle, part of why we talk about weight bias and weight stigma in the context of eating disorders is that we know that for individuals who live in higher weight bodies, these negative stereotypes, these biases, the bullying that happens, the discrimination, these are things that might leave people vulnerable to the development of an eating disorder. So if you live in a higher weight body and you're being told that, you know, you're not being promoted because of your weight, or people aren't voting for you because of your weight, individuals may be vulnerable to then engaging in risky dieting behaviors, disordered eating behaviors. So this is something that I think is uniquely tied to the development of an eating disorder, and something that's definitely a part of the conversation.
Well, in fact, aren't there some studies that exist that show sometimes a direct link between weight stigma and the possibility of binge eating or bulimia?
My neck is killing me.
Yes. So the Rudd Center for Food Policy and Obesity, based at UConn, has done a number of studies headed up by Rebecca Poole, looking at weight stigma in various settings and the consequences of that weight stigma. So they've definitely looked at the impact on disordered eating, other kinds of psychiatric presentations, a wealth of knowledge that indicates that this is really harmful in a number of different ways.
Dr. Peat, you have special experience with regards to people that live in large bodies. So I think you can speak directly to some of the bariatric issues.
Sure, and I think that, you know, one of the things that we see is that as much as we want to categorize individuals and say that, you know, those that live in larger bodies are different than those with eating disorders, the truth is that there is a large overlap in these populations. Individuals that have dieted for most of their lives, we know also tend to engage in risky behaviors that can look an awful lot and often are full threshold eating disorders. But because they live in larger weight bodies, they're often undetected, undiagnosed, and they don't actually get the help that they need. In fact, many times these individuals are praised for their weight loss, praised for the ways in which they go about moving that number on the scale downward, even if in somebody in a smaller body, we would then diagnose an eating disorder. So I think that it behooves us as a field to talk about these two populations in tandem versus separately.
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. It is currently 8:34 in the Dallas-Fort Worth area, and we are partying on social media. If you're not on the dial, then go to JP, Kathy, and the crew and watch us live as we are goofy, crazy. Kathy can be cranky.
Not as
I was
often as you.
I was waiting.
Not as often as you.
That's
We're also
because
informative
I'm
today
a
on the
girl.
breaks. We're informative on the breaks
We are.
today. I love that.
Yeah.
We're not just up to all kinds of shenanigans.
No, we're serious.
We are. And we're serious about the weather. It's sunny and 48 currently in the city of Dallas. We've got a high of 61 today and a low of 39, JP.
We do. And, I want to jump right back into weight stigma. We have Lisa Myers joining us and Christine Peat. Lisa Myers with, help me out, her Eating Recovery Center.
Academy of
Eating Disorders. And she's out of D.C. Lisa, good morning and welcome back to JP, Kathy, and the crew.
Thank you so much. Good morning back at you.
And then we've got Christine Peat with the University of North Carolina out in Charlotte. Thank you for joining us so much, Christine, as well.
Happy to be here.
Chapel Hill.
Or Chapel Hill, I'm sorry. What did I say?
You said Charlotte. But
I did. I'm sorry. I didn't mean Charlotte.
I listened to you, JP. I just want you to know I
Yeah.
am paying attention.
I meant Chapel Hill. It was a check on you is what it was.
Absolutely.
Well, what it is I'm already two steps down the conversation. We continued the conversation on weight stigma over social media. And I want to just put this out there as well. And I want to kick this over to you, Lisa, and then you, Christine, and get your feedback. What I find interesting is that a lot of weight, larger people, based on your behaviors and the way you see yourself and the way you reflect outward to people, has a big way on how you're treated by people. Let me give you an example. My mother, when she would go out, dressed to the nines. My mother was obese. But she always had on beautiful dresses, always wore a hat, always had her costume jewelry on, always smelled good. And no matter where my mother went, and this is no joke, no matter where she went, people globbed to her. You would think that she was hosting some kind of TV show in public or she was going to a rally. But people would come up and tell her, you look so beautiful. You have such a beautiful smile. Your eyes told me to come over and say hello to you. You're such a positive person. My father, the same way, obese, but great attitude. Weight doesn't bother him. Being a large bodied guy doesn't bother him. And he even does a comedy skit where he says that fat people make better lovers and wears t-shirts that say that. And people come up and talk to him because he's so positive. Myself, very positive outlook. When you come to see me, I'm bright-eyed. I'm not worrying about my weight. I'm not worrying about where my pant size is. I'm very positive. And so generally I generate a very positive response. Like the gentleman who made the commentary in 1998 was only one of 11% because I ended up beating my opponent by 89% of the vote. And so weight didn't make a difference. It just made a difference with that guy. And I'm not going to let that guy bother me. Can attitude not make a difference and overcome? Now, keep this in mind as well. At 430 pounds, I was playing indoor soccer because I'm athletic. Just because I'm big doesn't mean I can't move or I'm not athletic. It just means I'm big. Maybe a little slower, but I'm big. And so does any of that make a difference? We'll start with you, Lisa, and then Christine, if you'll come in right on the backside.
Well, no wonder you're so charming. Your mom sounds delightful. I wish she was with us on the program.
I love
today.
it.
Sounds lovely. The body mass index, or again, looking at a body, doesn't take into consideration the body composition. So you can have two people who have the same weight and the same height, and one of them has 13% body weight while the other one has 30%. The one with 30% probably has a higher health risk tendency, but there are so many other factors go into affecting the, and you, of course, are strong and you're vital and you're moving and you don't have high cholesterol and you don't have diabetes and you have a great positive attitude. And that makes all the difference in the quality of your life. But I think if somebody has been consistently bullied and raised in an environment where perhaps even his or her parents have been a part of the bullying. We've seen, there are countless examples of school systems that do a weigh-in of all of the children in front of each other, and the children that have come in at a higher weight, the coach may say, "Oh my God, you weigh so much," and then send a letter home to the parents. And a child who grows up in this bubble of people saying there's something wrong with him or something wrong with her because she's in a higher weight body is going to have a really hard time having the kind of positive attitude that you have. That's so wonderful.
And again, if I can just kind of dovetail into what Lisa has already presented, I think that this idea of having a good attitude and being able to present well certainly can serve as a way to help people maybe change some of their stereotypes about weight, about somebody's physical appearance. I think, though, that also, in addition to that, there tends to be a double standard for individuals that live in larger bodies. For example, if somebody who lives in a weight or a shape that is considered to be normative or kind of more typical, they oftentimes can get away with running errands in their athleisure wear with messy hair and no makeup without being subject to some of the really negative stereotypes that exist. But if individuals in larger or higher weight bodies do the same thing, they are often subject to those really negative stereotypes. So sometimes it feels as though there is pressure for individuals who live in larger bodies to present in that more polished way. And certainly if that's something that someone wants to do because that's just who they are, there's no problems with that. I think it's just making sure that there isn't a double standard, that that's the expectation. And I think that the other point I'd like to make, just so that all of the listeners are clear, is that weight in and of itself is not an eating disorder. So your weight status does not alone dictate whether or not you have an eating disorder. I think oftentimes we talk about these two things hand in hand, and sometimes there can be confusion. But just to be crystal clear, your weight and or your BMI is not an indicative feature of an eating disorder. It can at times be part of a clinical presentation, but it is not the only diagnostic criterion.
Dr. Peat, so on that point, do you envision a day soon where BMI is at a point where it's not even really relied upon by the medical community and word starts to spread to the insurance entities, then that you cannot strictly rely on BMI to make your treatment decisions here?
I think that all of us that are treatment professionals, myself included, feel very strongly that insurance companies should not be holding patients to a standard of meeting a particular weight or a particular BMI in order to receive care. We know that individuals who present in all kinds of body weights and shapes and sizes can be subject to really serious consequences of an eating disorder. So I think the more that we do to try and push back against that single standard, the better we can do for patients who have these really serious conditions.
Dr. Peat, I know that your point is very well taken, and I think that the listeners need to understand as well that that goes in both directions, that somebody who has what would be considered a normal BMI might also have an eating disorder. So you cannot tell by looking at somebody, and you need to be mindful of that. We talked a little bit on the break, and I want to make sure that both of you ladies have the time to talk about your organizations while we are on the air and give some contact information. Lisa, will you please state again your organization, what your mission and vision are, what you're working on, and how people can get in touch with you? And then Dr. Peat, also make the distinction between your work at UNC and what you're doing at NCEED. Lisa.
Thank you so much, Patty. The Academy for Eating Disorders, AED, you can find us on the web at www.aedweb.org. It's a professional society of the men and women like Christine. We're very proud to call Christine a member and, in fact, the chairman of one of our committees. It's a professional society of the medical professionals, doctors, psychiatrists, psychologists that are, and academic researchers that are trying to help solve this problem of eating disorders. And we're going in so many different directions, but if I had to capture quickly, we're looking at more communication, as I've already mentioned, with intermediary healthcare providers, communication and education with gynecologists, school psychologists, local mental health professionals, nurses, everyone, emergency room personnel. We just published, for example, and again, it's on our website, a new publication on what emergency room personnel need to know when somebody presents in the emergency room and they're severely ill, how to screen for and what to do if they suspect that what they're looking at is the result of an eating disorder. But the core priorities need to be, and I would put this first, making the economic case for the economic investment in research, treatment, new pharma, more treatment professionals, and getting at, as we hope to do as in the study that we're working on now, what are the economic consequences of not treating somebody with an eating disorder or not putting in place policies and systems that will prevent or detect early the development of an ED. And then a few others, getting funding for more treatment, helping public and private insurers understand the fiscal impact of not providing coverage for diagnosing and treating eating disorders early, getting funding for more research and getting more balance in the research that's being done, educating the public, parents, policymakers, educators, the media, everyone, and thank God for the great work that Cindy and her national center are doing to help us help the field accomplish this. Getting the word out about what a life-taking illness this is, and myth-busting the many false ideas about it. And hooray for you guys for helping with the mental health moments for helping with the myth-busting. And then finally, getting more mental health treatment providers trained and working in the field. More inclusion in medical schools of the topic, more psychological curriculum on ED, and getting more diversity among the treatment professionals. And finally, last, and then I'll stop talking, exploring technology platforms and solutions that might provide remote counseling to people suffering somewhere in the world where there just are no treatment professionals. I believe that there are three eating disorder psychologists in the state of Wyoming. And so
thank you so much, Lisa. We want to make sure that Christine has a minute to talk about her work there at NCEED. And take it away, Christine.
Go, Christine.
Sure, happy to. So for those who are unfamiliar, NCEED stands for the National Center of Excellence for Eating Disorders, and we're the nation's first and only center of excellence dedicated specifically to eating disorders. Our mission is to improve the detection and management of eating disorders by delivering education and training to healthcare professionals and the general public. So really what we're trying to do is provide information and training on the management of these conditions so that all individuals with eating disorders are identified, treated, and supported in recovery. So if you're interested in learning more, please visit us on our website at www.nceedus.org. And there you can find all kinds of resources, whether you're a healthcare provider across various disciplines, whether you are an individual with lived experience, or somebody who is a parent, family member, or caregiver. Our goal here is to really provide as much information and training as we can so that there's a better net of individuals who are able to provide treatment and support for those with eating disorders.
Your website has just been updated, and it is very, very helpful. And it is the initials NCEED, not NCEED like SEED. So nceed.org, right? Is that right, Christine?
NCEEDUS.org.
Ah, there you go. Thank you so much. This is very important.
Absolutely.
So, Dr. Peat, what does the future look like in terms of how treating this disease is going to evolve? You know, at what point, if at all, do we start to collaborate with the pharmaceutical companies or high-tech companies to maybe look at new ways to treat this?
That's a great question. You know, I think that there's a lot of really innovative research happening in terms of looking at the genetics of eating disorders, various biomarkers, and we also know that we need to be putting more effort into delivering scalable interventions for those with these conditions.
Well, and thank y'all so much. We're going to come back from the break and continue this conversation. Also, hop on JP, Kathy, and the crew on our Facebook feed today. Please, if you think you have somebody in your life who has an eating disorder, this show is crucial. These are experts who can get you the help that you need. So tune in, share this with your friends, post this on your Facebook page. We'd really appreciate that. Ladies, thank y'all so much, and we'll be back with more and talk a little bit more about what can we do to get involved in Eating Disorder Week? How do we help spread the word? So can we do that when we come back, Patty and Steve?
Yeah, I think that's a great idea, Kathy. We have more time this week to push that word out.
Excellent. Excellent. We're JP, Kathy, and the crew. We come to you live every Monday through Friday from 7 to 9 a.m. here only on 1160 a.m. KBDT News Talk Sports. All right, so when we get back, and however y'all want to direct it, but I think let's push that this is Eating Disorder Week, that there's lots of resources. Do you want to talk about that?
Absolutely. Thank you.
Because wasn't today a special birthday?
It was yesterday.
Yesterday, yeah.
Yeah, thank you for noticing that. This was really an amazing situation.
Home for you big time.
It really does, Kathy. So the last week of February every year is designated for Eating Disorder Awareness Week. And of course, sometimes the last week of February rolls into the beginning of March. Right. So this year, the last week was yesterday, February 24th, and it ran through, thankfully, to leap year. Thanks to leap year, it ran through March 1st. February 24th is Kelly's birthday. Kelly would have been 37 years old yesterday. And March 1st is my birthday. So I think there was a certain beauty and symmetry around the birthday bookends. Often Kelly's birthday lands within the week or my birthday lands within the week, but never since I've been doing this has it been the exact bookends. And it was due to the leap year that caused that.
When I read that gave me chills. I was like, wow, that's happening for a reason.
You know, and while we are on break here, I want to give a little bit of a shout out to Don Blackwell.
Yes.
Don hosted the Legacy of Hope Summit here in town last month. I know you both were able to attend live, and of course, we can't go into the specifics of what was discussed yet. But I wonder if you two, beginning with you, Lise, can just go into what your general impressions of that weekend was here.
Well, it was a phenomenal opportunity to focus as a field with folks from so many different parts of the field, focus on how we can develop a unified vision across the many organizations that are represented. Don did a great job of framing the conversation and was just wonderfully supportive in putting together structure and getting really interesting people to the table. So I appreciate being included in that.
Christine, how about you?
I thought, and I would echo largely what Lisa has said, that it was a great opportunity for the larger field to come together and talk about innovative ideas of how best to move the field forward. And I think if there was a single take home, it was really encouraging to see the amount of consensus that was trying to be built around these really important topics within the field. And the hope, of course, is that we can build upon that consensus and start to move the needle for eating disorders.
I also want to thank Ashton as well. Ashton helped get me in the door at Raytheon here in town, and Dr. Stephanie Setla from ERC and I presented about almost an hour and a half long presentation. Raytheon, they've got 67,000 employees here in the States, and the feedback we got was just incredible. There were two folks that day who reached out to the doctor for help. So, thanks to Ashton, Raytheon, we have a lot more corporate events like that planned just to bring awareness directly to large corporations with a lot of employees.
Well, this impacts everyone's life. At some point or time, somebody in your family or with your close circle of friends who is suffering or has suffered from an eating disorder. It is what it is.
Absolutely.
I like to use the phrase enlightened self-interest. This talks directly to the corporations and Lisa's study that's coming up. When we tell the corporations how their dollars spent will save money downstream, it's their enlightened self-interest that makes it happen.
Right. Good point. Good morning and welcome back to JP, Kathy, and the crew on 1160 AM KBDT News Talk Sports. Don't miss Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8, only on 1160 AM KBDT News Talk Sports. Just keep it tuned in 24/7 to this station because we bring you all kinds of great entertainment, all kinds of great information all day, every day, including the weekend. Currently, we have 48 degrees and partly cloudy here in Dallas. We're headed towards a high of 61. Colder tonight, low of 39. And let's turn it back over to Steve and Patty. Well, okay, they're both pointing at each other. Steve, Patty, Steve. Who wants to close it out?
I would like to start with Dr. Peat, because I know that you're doing a lot of work with NCEED and the University of North Carolina. So anything more or new that you've got going on with UNC and your work over there?
I would say that for folks that are interested in learning more about eating disorders, how you can be a support to someone, what you can do as a healthcare provider, our website is designed to give you all that information and more. So for those that maybe this is new for you, or maybe you're concerned about somebody in your life, please take advantage of the free resources that are there, and everything that we can do to help provide better support for these individuals is a step in the right direction.
Now, we also know when a person is stepped down, let's say from residential care to PHP to IOP, and then they eventually leave, there are so many issues with tracking their progress at that point. Is there any, do you see any type of technology on the horizon that will allow our doctors and treatment centers to better track the recovery of someone after they've left their direct care?
Yeah, you know, it's such a complex issue, and I think that a lot of it really has to do with having better communication between interdisciplinary teams. So this idea of making sure that there's a continuous line of communication between the inpatient level of care all the way down through outpatient, making sure that all the treatment professionals are on the same page. And even if that took, you know, a brief 10 or 15-minute conference, that would help allow all of the professionals to stay on the same page when it comes to discharge plans, making sure that everyone's outcomes are being tracked in a similar fashion. It's a big job, but I think that if we have the right minds and the right individuals at the table, this is something we can accomplish.
Lise, I know going back to 2012, AED was working on this extensive report, and one of the things that is within this report is that you should be planning your discharge from a hospital or a residential place on day one. I wonder if you could go into that and address if that's being done, and if not, what could we do to better put that in place?
Well, Steve, thank you for mentioning that. It's such an important thing, and actually day one minus day one, before you even go into the residential treatment, this is not, as you had mentioned earlier, this is not a disease where you can go in and you can take a few pills and you can regain your body weight. You can be tube fed and regain your body weight and fine, you look normal, you're okay. It doesn't work that way. Most patients have to be significantly treated for the mental health aspect of the eating disorder. And there's, as you know, a huge stigma around mental health of any kind. Parents don't want to admit that their child might have a mental disorder. The patient doesn't want to admit that he might need psychological counseling because, oh no, that's a terrible thing to do. And I saw a study recently, not to digress, but I saw a study recently that said that 97% of adults who meet the diagnostic criteria for binge eating disorder, which is one form of an eating disorder, did not receive a formal diagnosis. So in part it was because the healthcare providers that they saw didn't catch it or didn't screen for it, but in part it's because people disguise the fact that they're suffering. So getting people to acknowledge, you know, if I had a broken leg, I'd go to a doctor and get it fixed. If I have a severe, potentially lethal mental disorder, I may not want to tell anybody. And helping people, again, beating that stigma is so important.
Dr. Peat, in 30 seconds or less, what final advice would you give to folks out there who might have an eating disorder?
That if you do have an eating disorder, don't be afraid to reach out for help. Talk to your primary care doc, talk to a family member, and get the resources and the support that you need.
Thank you so much. As a matter of fact, we will put all of this information on our JP, Kathy, and the Crew Facebook Live feed. Ladies, thank y'all so much. God bless y'all for what y'all do. And just we wish you nothing but success. And we really appreciate y'all being part of the Crew and part of our mental health moment.
Thank you, ladies, for this very important Eating Disorder Awareness Week. Thank you for joining us.
And stay online after we go off air so we can wrap it up on Facebook Live.
Sounds great. We're JP, Kathy, and the crew. Have a blessed day. Tomorrow in studio, we have the one and only Miss Texas. Super excited. Looking forward to a great day. Everyone have a blessed one, and we'll talk to you tomorrow. Oh, there we go. Hey, ladies.
Hi there.
Thank y'all so much. Can y'all say again, Lisa, if you'll go first, and then Christine, and say how people can get in touch with y'all, and if there's any way y'all could hop on, or Steve or Patty, maybe y'all get on our Facebook Live feed so it comes off on y'all's feed as well, how to get in touch, and that it is Eating Disorder Week, and if somebody's struggling and somebody doesn't know the first step to take, where do you go?
Lisa.
Great. Well, thank you so much. The Academy for Eating Disorders, you can type that into your Google search bar, or www.aedweb.org. We have lots of information, resources, webinars, all kinds of information. And some of it is firewalled for members, but most of it is available. And you can find me there. If you have a specific question, don't hesitate to reach out to me directly. Lisa Myers.
Thank you.
Dr. Peat, say your contact information again, please.
Absolutely. So for those interested in learning more, you can go to www.nceedus.org. And you can find all kinds of resources there, whether you're somebody who is struggling yourself, whether you're a family member or a friend, or even a healthcare provider. And if you're interested in getting in touch with me directly, just hit the Contact Us section, and there are a list of websites, a list of emails, and you can contact me directly.
Finally, I want to give a shout out to three last groups here who've been fighting this disease for years. The first one, and they're the ones who came up with this week, the National Eating Disorder Association. It's a national group. They do some really good work. They get information out there. They have a basically a crisis help call-in line. So if you do a Google search on them, you can find them, and you'll likely to get the start of some help you need. The second group is called Feast. This group was started, I believe, in about 1997 by moms and dads who wanted to find a way to support parents out there. They've grown since then. They are an international group now. They do some really good work, and they have some good resources as well. If you do a Google search on them, you will find them. Their executive director is Laura Collins. She's got a lot of good information as well. By all means, reach out to them. And the final group we have is, they used to be called the Elissa Project here in town. This past year, they became the Texas Eating Disorder Association. They go out to a lot of the schools here in the state. They're getting active down in Austin now as well. Their executive directors, Kimberly Martinez. Their big event is next Tuesday, March 3rd. And we're just real excited to be associated with them and to help them as they help us.
Absolutely. I'd love to support all of those folks.
All right. Well, thank you, ladies. Great job. Great information. And just again, continue to keep up the good work, and use us as a resource whenever possible.
Thank you guys so much for doing this. God bless you for what you're doing.
All right, ladies. Have a good afternoon.
Thanks, guys.
Love y'all. Bye.
Bye-bye.
All right. Bye. We'll see everybody tomorrow. And Miss Texas will be in studio. So see y'all then.
I will too.
Oh, yeah. All of a sudden now Steve's coming back back-to-back days. There you go. Oh, please.
I just invited himself.
Yes. Oh, yeah. Oh, I'm coming back on.
Yeah, you wanted me here too, didn't you?
Yes.
What a deal.